I have no idea where I got this bruise. This bruise is actually on my leg. I noticed it randomly, and I don't remember bumping into anything. I don't remember hitting anything, but it was a pretty dark bruise, and it lasted for about 2 weeks. And in the beginning, it was a little bit painful. Of course, that subsided as the bruise went on. So we're talking about bruising today because clearly it's happened to me. I'm going to tell you what a bruise is, why it happens, who is likely to bruise easily, also what you can do to help your bruise if you get a bruise. Okay, guys, I'm Dr. Jen Caudle. It's good to see you. The medical name for a bruise is called ecchymosis. And a bruise really occurs when blood vessels underneath the skin become damaged and they start to leak blood. Okay, that's what a bruise is. Now, why does this happen? Well, most bruises, as you can imagine, happen as a result of an injury, right? Arms and legs, often you bump into something, you bang your arm. You bang your arm or your leg or whatever, and oftentimes you get a bruise. That likely is the cause of the bruise I had as well. I just don't remember what I bumped into. I'll have patients who come into my office and they'll have like a bruise from getting like blood work done, like when the person draws the blood and whatever, and it'll be like yellow or green, and they get worried about that. First of all, understand that when you get a bruise, it'll often start out as like red or what have you, but as time goes on, that color is going to change. Depending on your skin color, I'm African American, my skin is darker, bruises are going to look different on me than of somebody who's Caucasian, okay? So again, to start out, bruise may be tender, a little bit of swelling in the beginning. After a few days, though, the bruise may be changed to blue or black, and then 5 to 10 days later, it could turn to green or yellow. See, there's the green or yellow. And then it can go to light brown and then sort of start to fade away. And oftentimes, as it's going on, it's getting lighter and lighter. So if that happens, don't be alarmed because that's actually pretty normal, okay? Now, easy bruising. What would I classify as easy bruising? Bruising, and there's no good reason why. You don't remember and you didn't hit yourself, bump yourself, things like that, but you bruise. Bruises that are really large, bruises like multiple bruises, smaller bruises, but you just have a lot. Bruising when you never used to bruise. And I guess the list sort of goes on. Anything that seems abnormal about bruising for you, this is when I would say, hey, ding, 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 is there something going on? Now let's talk about potential causes for this. Why might you start bruising when you didn't before? Why might your bruises be large or unusual, etc.? If this happens, you need to be seeing your doctor. Okay, certain medications can cause you to bruise more. I don't know why I'm having a hard time saying that word. I'm like, bruise more. Blood thinners, obviously, okay? But also medications, things like NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, things like that, aspirin, even steroids, prednisone, can actually cause you to bruise more easily. So keep that in mind, like if you start a new medication. Also, aging skin. As we get older, our skin gets thinner, okay? And it's less protective, meaning we may bruise a little bit easier because our skin is less cushioned, is less protective, it gets thinner, etc. So keep that in mind. Also, there are underlying medical conditions that could cause you to bruise more. Things like bleeding disorders, platelet disorders, connective tissue disorders, Marfan's disease, and some other things. So if you are in the workup for a connective tissue disease or you've got some underlying medical conditions, that could be playing a role. Also, alcohol consumption, heavy alcohol, and even liver disease can cause you to bruise more easily. Here, I still can't say the word. Also, vitamin deficiencies. We worry about things like vitamin C and vitamin K. And don't forget supplements. A lot of people think that supplements are completely benign, meaning they don't cause any problems and only help. Remember that there are many supplements that can actually cause you to bruise more easily. Things like vitamin E, ginkgo, ginger even. If you bruise and if you are bruising easily or too much, the bruises are big, they're painful, whatever, you got to see your doctor. Anything unusual potentially about your bruising, you got to see your doctor so that they can run lab tests and really sort of investigate what might be going on. All right, now let's talk about how to treat a bruise, okay? If you get a bruise, you want to obviously rest the area. You don't want to bang it anymore, but if you can, you want to elevate the injured area if you can to prevent swelling and to relieve the pain. That's immediate. immediately after you get a bruise. You can use ice packs on the area for like the first 24 to 48 hours after injury, okay? And so you could like wrap an ice pack in a towel and apply ice, 15 minutes at a time or so. And by the way, I actually have some videos on creative ways to make ice packs at home. So I'll link that here if you're watching on YouTube. If you're watching on Facebook, just ask me for the video if you'd like it. Also, then after that sort of 48-hour period of time, you can switch to applying a heating pad or a warm compress, okay, if that's helpful and comforts you a bit. Remember that bruises can take sometimes up to 2 weeks to go away. So if it feels like it's lasting for a long time, up to 2 weeks, well, that might actually be normal. Any bruising certainly that lasts longer than that, you got to get that checked out. Let me know in the comments if you bruise, what you do about it. Guys, I'm Dr. Jen Caudle. Please subscribe to my channel, click the bell for updates. Please follow me on Facebook. I'm also on TikTok, LinkedIn, WhatsApp, Instagram, you name it. Please follow me. Threads, follow me everywhere. Also sign up for my free weekly health newsletter at drjencaudle.com.